I have been putting my dog in the chamber, Dante. He has irritable bowel disease, and he actually now yells at me to go into the chamber. I've had numerous patients witness this. If I'm putting them in the chamber, he's asking to go in with them. The following podcast is a Healthy Dog production. Welcome to the Healthy Dog Podcast. I'm your host, Dr. Nigma Talib. I'm a leading naturopathic doctor now for over 20 years, and I've consulted thousands of patients with chronic illnesses. I've had clinics all over the world, and I have a #1 bestseller, Younger Skin Starts in the Gut. Listen, I know there's a lot of health information out there in the health and wellness world, and it can be a bit overwhelming. So I'm here to set the record straight and give you my expertise along with my expert guests here in studio in sunny Los Angeles.
I only take drugs with other people who take them on a regular basis because I don't have time for that.
A lot of chronic diseases stem from mitochondrial dysfunction.
Yes, and you know what I love talking about, right? Poop.
Yes. You can ask me about my poop?
Yeah, I'm going to talk about poop.
Okay, please.
This podcast is your go-to for achieving optimal wellness from the best of beauty and longevity and everything in between, because after all, wellness comes from the inside out. Welcome to the Healthy Dog Podcast. I'm your host, Dr. Nigma Talib. Hyperbaric oxygen therapy, otherwise known as HBOT, involves breathing in pure oxygen in a pressurized tube or a room, and it's well established for compression sickness. But what else is it good for? Today we have the CEO of OxyHealth, who's a world-renowned doctor and specializes in hyperbaric therapy. Can I introduce you to Dr. Mayur Patel? Nice to have you here.
Yeah, thank you for having me today.
To date, your company has sold over 15,000 hyperbaric oxygen units. Where did you come up with being a doctor and then going into hyperbaric oxygen therapy?
Yeah, of course. Well, we've actually sold 18,000 units over the past 25 years. So as you can imagine, we're very well experienced. We've seen a lot, and we've also had the pleasure of watching this industry grow and evolve. It's a lot different how hyperbarics is used today than how it was used 20, 30 years ago. So as you can imagine. A little bit about my background is I'm actually a pharmacist. So I went to pharmacy school, got my PharmD, and rather than going the traditional route, it was actually my dream to one day open a functional medicine compounding pharmacy. Very much aligned with this industry and what we're doing. However, along the way, with my family background in hyperbarics with this company, I saw an opportunity. And I saw a need. There was a need for more awareness around hyperbarics and what it can do. I saw many limitations and a lot of research to really show that this is a therapy that has a very broad application around a regenerative approach overall. Mm-hmm. But it was limited. And so my involvement in the company really started with finding different ways or exploring new opportunities to alleviate this barrier, to really open the door, which is where I bring my background in pharmaceutical, especially my skill set in research, to really find an evidence-based approach to not only showing and validating what hyperbarics can do, but to build off of as we move forward and this industry evolves.
And you said something really interesting. I mean, hyperbaric has been around since the 17th century, actually, if you think about it. And it just got more popular after World War II. And so I wonder, for decompression sickness, which is the air bubbles in the blood, if people don't know what decompression sickness is, if you've ever scuba dived, I haven't, but it's one of those things that I always get worried about. Mm-hmm. But it's one of those treatments, and also really good for carbon monoxide poisoning, now used for wound healing. And I think those were the basic ones in the last 10 years that have really been more established and scientifically validated. But in my experience as a naturopathic doctor, I've seen patients, when I had my practice in Vancouver, I would refer them to hyperbaric oxygen therapy for anyone with a stroke or cardiovascular disease. Can we go more into that? Because I feel like that's where there's a lot of confusion on who can use hyperbaric oxygen therapy. Is it only for extreme cases, or is this something that can be used in conditions? Let's start with stroke. Let's start with that one.
Of course. So let's start with the basics of hyperbarics, because it'll make a little bit more sense why they're being applied to a lot of these other indications. We have a modality that has very strong anti-inflammatory properties, right? So right off the bat, you have something that has strong anti-inflammatory properties. We also have a modality that can help produce more cellular ATP, so improving mitochondrial health. I have one of my, I firmly believe that a lot of chronic diseases stem from mitochondrial dysfunction. Yes. So now when you focus on optimizing the mitochondria, we can really see how this can potentially have a broad application, because they're all stemming from one common factor, or one of the many common factors as well. There's also an effect on stem cell mobilization, right? So research has shown that hyperbarics can mobilize the stem cells that we have in our bone marrow into your blood circulation. So the reason I bring up these three different mechanisms is, as you can imagine, they tie into an application like stroke, right? So we're getting more blood flow to an area that's ischemic. Not only are we getting more blood flow, but we're kickstarting different things such as neurogenesis with some of the long-term factors at play with hyperbaric therapy. We're also reducing any residual inflammation that may be causing a decrease in circulation to that affected area as your body tries to protect itself. And with stem cells, of course, we have unprogrammed cells circulating through your system and actively looking for different areas to work on, areas that are creating a demand. So the three in combination can really go to support something like stroke. So with stroke patients, hyperbarics isn't necessarily activating the dead tissue in a stroke patient, like from a neurological standpoint. But the area around the dead tissue, the intermediate tissue that may be in kind of like this intermediate zombie mode, that's the tissue that hyperbarics has shown to really activate, which is why we see a presentation in clinics where patients are responding to something like hyperbarics. So if somebody, for example, had their broca was affected, for example, we might see some progression in their speech. Doesn't mean that you're going to necessarily have a full recovery to baseline, but we're able to slowly move the needle and improve depending on the severity of the person's tissue or the brain matter.
I want to share something that could literally slow down how you age, inside and out. Let's talk about hyperbaric oxygen therapy, or HBOT. You've probably heard of it being used for athletes or wound healing, but what you may not know is the latest research is showing powerful benefits for cellular regeneration, brain health, and even reversing some biological markers of aging. Hyperbaric chamber works where you breathe in oxygen at higher than normal pressure. This process stimulates your tissues with oxygen and beyond what your body can normally get in. That extra oxygen jumpstarts your cells, helps natural repair processes, reduces inflammation, and boosts collagen production. It even stimulates the growth of new blood vessels. Studies have shown improvements in telomere length, which are kind of like protective caps on your DNA that shorten as you age. Longer telomeres, that's linked to healthier aging. If you're feeling the effects of aging, maybe it's slower recovery, brain fog, or skin that's lost its luster and glow, hyperbaric oxygen might be a powerful tool to help you feel sharper, stronger, and more vibrant. Go to OxyHealth.com, that's OxyHealth.com, and type in discount code HealthyDoc10 for your first order. One of the things I want to sort of rewind on is you made a good point. What is hyperbaric oxygen therapy? I talked about it being pressurized. Now let's go back there for 1 second for the people listening today, because I was just going to be like, what is this? What is hyperbaric? And why is it important for there to have a certain pressurization in order for the oxygen to come in? Are we able to explain it to our audience in a way that they can understand what hyperbaric is exactly?
Of course. The way I like to put it is it comes down to air density, right? So the higher the pressure you go, the more dense the air is. This concept of hyperbarics, we've actually been acclimated to or exposed to at some point in our life. If you look at climbers, for example, or individuals that go to Colorado, there's a reason why you get shortness of breath, right? The air at that altitude is a lot less dense because there's less pressure. So pressure is the driving force for oxygen to go into your system. Without pressure, you don't have that driving force. Naturally, we're at 1 atmosphere, right? We're at sea level. So we have just enough pressure to get just the right absorption in which our bodies have adapted to, so we can get adequate amount of oxygen, something that's vital to our everyday living, and continue functioning, right? So when you're in a hyperbaric chamber, you're increasing that pressure, you're increasing that density, and you're therefore increasing the driving force that's pushing these oxygen molecules into your system. So in a hyperbaric chamber, for example, at 1.3 atmospheres, it's about a 30% increase from the pressure we're breathing now. Very commonly, you'll see this pressure in home hyperbaric units. Studies have shown that there's a 50% increase in the amount of oxygen molecules that are shown in your blood plasma.
Wow.
So by increasing pressure, we get that driving force to push that oxygen into our body. However, our body already has enough oxygen, right? I mean, if that weren't the case, we wouldn't be sitting here talking right now, right? We're able to take an ample amount of oxygen for us to function properly, and even have some on reserve for very strenuous activities, like if you're an athlete. In a hyperbaric chamber, not only are you topping off your body's ability, your red blood cells, let's say, that are carrying your oxygen, but you're forcing oxygen into your bloodstream regardless. So now you're having direct oxygen delivery to various tissues. You're introducing oxygen as a supplement on a cellular level. So on a level that your cells are familiar with, that are able to actually use it to increase the amount of energy that they're producing as well. So it's a very simple concept, or I'd say it's a very simple concept, but a very complex set of consequences, positive consequences that come from introducing oxygen into your body.
And now we have different pressures for different ailments, correct? I know we were talking about pressurization prior, before we started our podcast today. Can we go over those pressures? Because a lot of people will advertise, in their wellness center and say, we have these chambers available. And what are the chambers that what do we need to look out for as, an audience? Like, say we want something for optimal wellness, we want something for bone density, or if we've had wound healing, somebody's just had plastic surgery or had a microneedling treatment with Dr. Nigma. We know my microneedling treatments are pretty brutal because I go quite deep into the tissue. So it does take longer to heal than an average microneedling. So what would we tell somebody, what kind of chamber would they need to go into?
Well, it really depends on what they're using it for. So you were pretty spot on. For example, with bone density, there is a certain effect that higher pressures have on bone density as far as effectiveness is concerned versus lower pressures. So for a patient who is looking to focus on that area, they would require that protocol for a higher pressure chamber, for example. But when you're looking at a stroke patient, for example, or a patient with some kind of neurological disorder or deficit, now there isn't necessarily a requirement for higher pressures. And there's actually research to show a similar response, if not a better response overall to some of these lower pressures in the 1.3 to 1.75 range. There's actually a CP study where they saw a detrimental effect after 1.75 when these children were going to higher pressures greater than 2.0. So it really goes to show that there isn't like a one pressure fits all.
More is not.
More is not always better, but less isn't always as good as more. And so this is where exactly.
You just got to figure it out.
You just have to figure it out, and not just figure it out, but there's research out there. And so this is where an evidence-based approach really comes into play, and making sure that you're using the evidence out there for your use as you're structuring these protocols. There are organizations out there. One of them, for example, is the International Hyperbaric Association. they have a network of doctors that are actively working and building on these protocols that are evidence-based from their communities, and they're actively working to eventually build a set of guidelines for hyperbarics. So there are 14 FDA-approved indications for hyperbarics. There are 40 plus off-label indications that hyperbarics is currently being used for. And it's really up to organizations like the International Hyperbaric Association to help structure proper guidelines around the off-label uses, as there really aren't any official guidelines for something like hyperbarics and stroke, right?
And that's my next question. Why is it taking so long? The Mayo Clinic, I think, only got a chamber in, 10 years ago. And that was by force. That was by this is a proven is a bad term, but it has been shown to really help with, wound healing, stroke, cardiovascular illness. I've seen it clinically in the last 20 years of my practice. Why do you think it's being shushed, the hyperbaric oxygen therapy?
I believe there are a lot of factors at play. Traditional hyperbarics, again, was built around high pressure hyperbarics using 100% oxygen. As you can imagine, at that amplitude of oxygen exposure, it's toxic.
Exactly.
So it can be toxic. I believe that a lot of the pushback for hyperbarics and why we haven't seen it fully accepted into modern medicine is because mild hyperbarics didn't exist prior to OxyHealth's involvement. A little bit about us. The founder of OxyHealth pioneered the portable hyperbaric industry. So he not only he had this concept of a portable home hyperbaric chamber, which was taking this concept of having a hyperbaric chamber in a hospital. It was inaccessible, very expensive, and only used higher pressures. And he wanted to find a way to make it more accessible, but to make it safer. And one of the biggest concerns around safety was the amount of oxygen that you're consuming in these devices. So this is where portable hyperbarics really came in. And when he brought the world's first portable hyperbaric chamber to the market, there wasn't any research. He didn't know what it can do, but he wanted to see what you can do with it because he had read reports of individuals over the course of history responding to minimal levels of pressure. I mean, the Dead Sea, for example, they were taking individuals with different chronic inflammatory diseases, like in IBS, for example, to the lowest point of the Dead Sea, and they were responding. So there was some substance there. He just didn't know what, right? He was an engineer.
Let's talk about that. So below sea level is the pressurization that the chamber goes to. Can you explain that a little bit more?
Yeah, of course. So the portable hyperbaric chamber is the ones you'll commonly see in homes.
The one I have?
The one you have is 1.3 atmospheres. So that is actually simulating 11 feet below sea level. So hyperbarics started from the sea with scuba divers. That's part of the reason why one of the indications is decompression sickness was to treat these scuba divers. And so when you look at a dive chart, a lot of the pressures coincide with feet of seawater. So 11 feet of seawater, 10 to 11 feet of seawater is about 4 psi gauge or 1.3 atmospheres. And so it really depends on what depth you're going to, but scuba divers are experiencing these different various pressures as they dive. And so tying into safety on a scuba chart, there are certain depths where you have to follow a dive chart as you ascend, or you risk a lot of potential safety concerns with rapid decompression sickness. So again, this is part of why I believe hyperbarics hasn't been widely accepted, because of the risks. There are a lot of risks putting yourself at some of these extreme pressures. There are a lot of benefits, but medicine is about weighing the differences between the two to see if it's a right fit for your candidate. So if you had a modality that has research, but not as much as a pharmaceutical drug that has research about the potentially high risks as well, they're going to choose the drug every time, right?
Of course.
And it's such a niche industry that there really is not enough funding behind a lot of the research. I myself am very excited for the next 5 to 10 years. I do believe more institutions will jump in and push for more research, because a lot of questions need to be answered to find out, especially now with the emergence of lower mild pressures.
From PMS to perimenopause to menopause to postmenopause, I've lived through it all. And through every stage, one thing becomes clear: Hormone fluctuations change how our bodies regulate temperature, especially at night. When your body overheats, even slightly, it disrupts deep, restorative sleep. The kind of sleep your hormones, metabolism, and mood depend on. That's why I can't live without my Rani Lounge pajamas. Their advanced technology activates natural fibers, making the fabric moisture-resistant, naturally fresh, and ultra-breathable, allowing your body to stay cool and regulate temperature the way nature intended. Better temperature control means deeper sleep, better recovery, and a body that feels truly at ease. Whether at home or traveling, staying cool, fresh, and comfortable has never felt so effortless. Go to RaniLounge.com, that's RaniLounge.com, and use my code HealthyDog15 and get 15% off your first order and experience sleep the way it was meant to be. I have been putting my dog in the chamber, Dante. He has irritable bowel disease, and he actually now yells at me to go into the chamber. I've had numerous patients witness this. If I'm putting them in the chamber, he's asking to go in with them and leave me behind, which is, as you can see, he's like a Velcro dog, never wants to leave my side. But when it comes to the hyperbaric chamber, he wants to go in. And he has actually done really well with his irritable bowel disease. He's on a special diet, but I really think it's helped, and it's helped me. It helps me sleep at night. And, sometimes I go in for an hour, sometimes I go in for 45 minutes, but it's about 3 times a week. I really notice a difference. And this is what you call mild hyperbaric oxygen therapy. And could it be that people like myself are, stressed out, working, forget to breathe, once you go to the chamber, you're getting this pressurized oxygen that is just filling your red blood cells and pushing and forcing you almost to breathe and putting you into a state of relaxation. So I think there's a lot in it, because IBS, IBD, anxiety, oxygen, there's a correlation, you know?
And, I think there's a bigger picture here as well. The world we live in is extremely toxic.
Fair enough, yes.
Our environment is only getting more toxic every day. I mean, I hear this all the time, how there's an analogy, right? We consume a credit card's worth of plastic every day. I heard somebody discussing that earlier. That is true. You consume quite a few plastics on a daily basis. You also consume quite a few heavy metals. You're exposed to different toxins, right? There are so many pollutants out there. I do believe that part of the reason why a perfectly healthy person responds the way they do to something like hyperbarics is because their body's constantly adapting and trying to overcome the exposure of these different toxins that generally would, for somebody who might be a little bit more sensitive, would be debilitating or affect their quality of life significantly. But for another individual, may not affect their quality of life, but has a slight impact on their daily life and function. So when they use something like hyperbarics, there is a metabolic effect, for example, right? So hyperbarics has a very strong metabolic effect. You are detoxifying during your session. So I think that's part of the reason why some individuals come out saying, wow, I feel amazing, right? Because they don't realize that whatever they ate for lunch may have an effect on their cognitive function, which is why they feel brain fog, right? Or what they did the night before.
Right. Because everything's going to your digestion to digest, and you're losing that blood flow to the brain as well, and that oxygen.
Yeah, 100%.
And so how do people figure out, what chamber to use, or what chamber, if people are listening and they want to get a device for their home, how do you decide which chamber to get for your house? Yeah,
well, first, consult with a doctor, regardless if you're going to a clinic or putting this in your home. This is a prescription device.
So what are let's talk about the contraindications. Who cannot go into a chamber?
Biggest one, if you have an active or history of a pneumothorax, you are contraindicated for
which is a puncture in your lung, by the way.
Sac of air in your lung. So it's something not fun. It's not something that you would not know you had. You most likely have been in a hospital setting or have been working with a doctor to solve this issue. So that is the main absolute contraindication. An inability to clear your ears. So if you're unable to equalize your ears, that is a contraindication. More so the concern is comfort, but when you're going to extreme pressures, it is a contraindication because there can potentially be some barotrauma if you're unable to equalize your ears properly. And the third one is claustrophobia. because the last thing, and these are absolute contraindications. There's a long list of relative contraindications, but claustrophobia, of course, somebody who is unable to be inside of a hyperbaric chamber shouldn't be somebody who's forcefully put inside.
Right.
So this is something that you want your patient to be aligned with,
right.
To accept. Definitely don't trap anybody inside of a chamber unwillingly.
I did it to myself. I'm very claustrophobic. When I got the chamber, I was like, how am I going to do this? And after I literally just closed my eyes and I was just like, you just have to talk yourself. And it was just one session and I felt the benefits and I was like, I'm going to get over this. So I think you can. Even somebody like myself who's super claustrophobic, you will get over it. It's just the home ones, before they inflate, it's quite, closed in. But then as it inflates, it becomes a larger space and you can see out through the front. So
it's a lot roomier.
Yeah, it's a lot roomier. And it's not a long time to decompress as well. So, if you do feel, you can always decompress yourself and let yourself out.
Yeah. And I myself am actually very claustrophobic. So the first time I tried to go inside of one, I couldn't do it. I got inside, felt like I couldn't breathe, and got out immediately.
Yes.
Then the second time, I reminded myself, that feeling that I couldn't breathe wasn't necessarily because I couldn't breathe. It was just anxiety driven. So I reminded myself mentally, if there's one place in the world where I absolutely can breathe, it's inside of this
That's
chamber.
Exactly what I did.
So don't think I'm suffocating.
Yes.
I know it feels tight, but
Yes.
it's in my head. It's a mental block. And once I got over that, it really completely changed. Honestly, it changed my life.
Me too.
I
Yes.
look forward to using my chamber every day.
Me too.
I haven't gone a single day without missing my regimen. So.
And it's so great. I do all my work in there if I need to, or I'll do a meditation. And he goes in there and he goes to the other side of the chamber and just leaves me. It's like he wants his me time. It's like, I've had enough of you. I'm a Velcro dog, but whilst I'm in here, this is all about me. And he literally sits in there and I can't say, do you want to go in the chamber? I'm closing his ears now because he wants to go in it all the time. It's really, really funny.
Yeah.
And so I feel like animals know, and I feel like he's done, exceptionally well. And I think healed his gut from that. True wellness lives in the smallest details: the air you breathe, the water you wash with, and the surfaces you touch. That's why Koala Eco, with their beautiful botanical ranges for home, laundry, body, and even pets, is the only brand I trust. Elegant living without compromise. Visit koalaeco.com, that's KOALAECO.com, and use my code HEALTHYDOG15 for 15% off your first order. Not everyone can have a chamber in their house. So if they're going out and looking for chambers, this is something that I found really scary, Dr. Patel. And correct me if I'm wrong, are there a lot of chambers out there in the state of California that are unlicensed, non-FDA compliant devices? And what do you say about that?
There are quite a few chambers, not just in California, across the United States and across the world that are just unregulated. So when I say unregulated, FDA is a part of it, but there are other organizations as well, FDA being the biggest because this is a prescription device. But yeah, there are a lot of manufacturers out there smuggling chambers into countries like the United States as sleeping bags, for example, and getting them into patients' homes. I'm all for increasing accessibility around hyperbarics. Yes. However, when it comes to a medical device, you're putting a human life inside of it. So whether you're putting yourself in, you're putting your family in, you're putting your own child in, you want to make sure that everything that they're doing inside, everything they're consuming is safe for their use, especially under pressure. So for example, the FDA regulation, the 510K clearance we have, that's my stamp of reassurance if I were a consumer, that would be my stamp of reassurance when I'm looking at medical devices or specifically hyperbaric chambers, that this device is from a reputable manufacturer, that they have things in place for good manufacturing practices, right? So not just having an actual manufacturing facility with with proper practices, but are they doing the proper tests? Are they testing their materials to ensure that they're safe for human consumption, that they're not off-gassing anything into the unit that your patient would eventually be breathing? Are they using adhesives, right? We don't use any adhesives on our chambers, for example. Everyone thinks that we're gluing our seams together. This is a medical device. It's unheard of to do that. We use something called sonic welds, right? So it's welding it at a certain very high frequency that's kind of meshing the material together. A lot of manufacturers, they put adhesives on there. Adhesives, as we know, they're toxic. They're man-made, and a lot of them off-gas.
Yeah, they're glue, basically.
They're glue. And
so
I've
you're
actually,
inhaling the oxygen with the glue. Yikes.
Under pressure, which is even worse, right?
Oh, wow.
So
Okay.
under pressure, because of that driving force. Like our lungs are very smart. They take what they need.
Right.
But under a driving force, they take what they need, but they're forced to take more than
Right,
what they
than they
actually
usually-
need. So that's the scary part, off-gassing
Wow.
inside of the unit. And I've actually seen this at a show before. So I went to a conference, and at the conference, I like to look at, what else is out there, what competitors are rising. I just love innovative tech in general. And I sat inside of a hyperbaric chamber that person claimed that they were waiting for their FDA approval. It had been submitted. And from the moment I sat inside, it smelled like adhesives. I couldn't really, it's hard to explain it.
Yeah, you
go
sort of
inside
know.
and
You can smell
I'm
it.
very sensitive to different
yeah.
things. So
Me too.
I instantly felt it. I felt like I got
Yeah.
hit in the face with
Yeah.
something. And it wasn't something I personally would ever want to go in, let alone put a family or a patient inside of. So it's really important to pay attention to certain things. If you're at an in-person event and you see a unit, pay attention to the smells inside. That's a pretty good gauge of what materials they might be using as well.
Interesting, because this is I think becomes a really key point for people out there that are going to centers that have hyperbaric chambers, because there's other things that can happen. I mean, not to scare anyone, but I have seen instances where the chambers can actually blow up, if they are not, compliant. So I think it's super important that all of your chambers are FDA compliant. So that's really amazing. And that's why I went to your chamber immediately, because I was like, I want an at-home device that I can actually use for patients if I need to, because after they get one of the Dr. Nigma microneedling sessions, it's a long recovery. It's like almost a week. So I find it speeds it up by like half. So if you did the chamber at least once a day for the 7 days, you would literally end up with 50%, less, I would say, side effects or healing time. Okay, well, this is good to know for people that are listening out there. I've built my entire clinical philosophy and even wrote a book called Younger Skin Starts in the Gut around one simple truth. If your gut isn't optimal, nothing else works. Genova Diagnostics GI Effects Test is the gold standard in functional stool testing, mapping your microbiome, digestion, inflammation, and nutrient absorption with clinical precision. It's a crappy job, but someone has to do it. And no one does it better than Genova. Visit genovaconnect.com and use my code HEALTHYDOC15 for 15% off your first stool test. Is there anything else we missed, Dr. Patel, that you wanted to add about the hyperbaric industry or hyperbaric in general, what it's good for?
Yeah, of course. I would say hyperbarics, just like your dry needling, for example.
Yes.
This isn't something, of course, if you're having a traumatic type of procedure, or if you're causing some type of damage to the body, like intentionally.
Plastic surgery.
Yeah,
or
like
something.
plastic surgery. You, of course, want to use hyperbarics in your follow-up. But what I'm seeing a lot of, and what I believe is very important to consider, is you should consider using something like hyperbarics before the surgery, for
Right.
example. So when you use it before, you have your immediate benefits, right? So when you're inside,
Right.
you're having an increase in circulation, better oxygen delivery, you're having an increase in ATP production. But a lot of the longer term mechanisms, like different growth factors, the stimulation of angiogenesis, those take some time, right?
Right.
So you're not for angiogenesis, for example, you're not building new capillary beds right off
away.
the bat. It takes some time to get to that point.
So to do it beforehand.
You're priming the body when you do it beforehand.
Okay.
So by doing it beforehand, we work with a lot of plastic surgeons, and what they'll do is they'll prescribe 2 months of hyperbarics, one before the surgery and one after. So they pre-treat for about a month at home. They're consistent. They stay on track. They have their surgery, and then they do their 30-day follow-up.
I love that. And that makes so much sense. And I do that with a lot of my patients as well. Dr. Patel, this was so informative. I'm looking forward to more doctors coming and talking about hyperbaric oxygen therapy. It's more than what it should be used for. It should be used for maintenance. It should be used for anxiety. It should be used for, wound healing. It should be used for so many other things than what it's indicated to be used for. So I really hope that a company like yours is going to pave the way for the future. And I'm excited for the next 5 to 10 years as well. So I really think this is going to be something that people are going to have in their own homes and use on a daily basis. Yeah. Before I let you go, I know you know what industry I work in, right? You know I'm known as the poop doctor, right? So I wanted to ask you a question. How many bowel movements a day do you think is normal for the average person? And this will be easy for you because you're in this industry,
I would say 2 to 3.
2 to 3. Okay. Wow.
At least one.
That's like super healthy. Well, I think it's also about how much you eat as well. But I think if per meal, if you're having a bowel movement, it's super healthy. As long as it's S-shaped, all in one form and sinking, we're good. But if it's the other stuff, I don't know if you've ever seen my poop video about the different, I've got pebble poop and porridge poop. There's a bunch of them. There's a bunch of the poops. You have to have the regular S shape. But that was a good answer. That's probably because you're so healthy. I wanted to give you a little gift for joining me here today. And it's a bunch of my goodies, but it's also a poop kit. And it's by Genova. You're going to be doing a 3-day poop sample, not here right now, but when you get home, over the next 3 days, you're going to do a sample, and it's going to look at who's actually living in your microbiome. And we'll have a follow-up consultation to review all of your results. So I'm looking forward to that.
Yeah, likewise. Thank you. I really
Thank you
appreciate it.
for coming on the Healthy Dog Pod. And for those listening, where can people find you?
So we're at quite a few trade shows. You could always find us on our website. It's www.oxyhealth.com. And we're at quite a few trade shows. So if you're at AFRIM, the Anti-Aging Longevity Conference in December, we'll be there. We'll be at the Biohacking Congress, and we are pretty spread out throughout the year. So hopefully we can run into you. And if you also go on our website, we do post a lot about which trade shows we're at. So if you'd like to come, or if anyone would like to come see our chambers in person, we do highly encourage that as well.
Amazing. Thank you again so much for being here, Dr. Patel.
Thank you for having me.